I'm Huples Cat. What am I going to do now? You can improvise, you can use your coat, depending on the weather. It's too cold today for that. Or you can take out part of your tent or part of a tarp. In my case, I've got the sleeping bag right here, so I'm going to use this. Ow! Hurts every time I move my foot. Oh. But get off the ground. It's absolutely critical. I'm starting to overheat. About -9 centigrade. So I'm going to ask myself some questions. Did I hear or feel a tear? Did I hear a popping noise or a cracking noise? All of those things are indicative of an unstable injury. I'm hoping I have a stable one.
Backcountry medicine worries less about what exactly is wrong and more about what the issue means for us.
One of the critical things to ask, especially if you're not the victim, is have you had this happen before? If you've had joint injuries in the past, the chances of having them in the future are really high. Okay, let's get into the nursing diagnostics section. In this case, it's my left ankle that hurts, but you always look at both feet, both arms, look for symmetry. I'm going to look at my normal foot first. Right. Normal range of function. Don't see any abrasions or blisters. Feels fine. Temperature's normal throughout it. What about capillary refill? I blanch the nail bed for about 5 seconds. Let go, goes pink again. You should do this on all of the toes. First thing I'm going to do is leave this exposed. I'm going to put this here because it's cold. I'm then going to have to take off this boot. Now if you've got somebody else with you, get them to do it. Get them to do it gently. Oh, oof, oof, oof. It hurts there. Okay, this is really hurting. Do not cut it off. If you have spare socks that are loose, you might. In my case, I don't. I'm not going to cut this sock off. I'm going to need it. It's cold. Same thing I did on that. Is it normal temperature throughout? Is the sensation normal throughout? Is the capillary refill after 5 seconds blanching the nail bed? Bang, goes pink again on all of them, is fine. What about range of motion? This one's fine. This one, it hurts. I know it hurts. Can you move it anyway? I can wiggle my toes and spread them, that's good. It really hurts there, but it moves. I probably have a stable injury.
Can the person still use the affected body part? Will it heal on its own in the field, or does the person need to get to a doctor? With musculoskeletal injuries, it isn't really relevant to us whether it's a tendon strain, a ligament sprain, or even a small fracture. We'll leave that diagnosis to the doctors in a clinic. What is relevant to us is whether the injury is stable or unstable. A stable injury might be sore or even painful, but the person can still use that body part.
I have normal colour sensation movement on the right foot, normal colour sensation movement on the left foot, except for some bruising here. At this point, get your feet covered up, especially when it's like this. You might not be in a hurry in Puerto Rico, but I'm in a hurry here. Start with the unaffected side. If you can, and there's two of you, get the person who's injured to do this. Try not to do it for them. You can assist, but you don't want to cause any pain because they might need to trust you. Principally, I don't want to bend this. This is what the problem is. Next, let's see if I can stand up. Feel free to help them. Make them do the work. Take your time. Whoa, so difficulty, I can stand up non-weight bearing. The test, can I put weight on it? Kind of. I'm really favouring this side and that's normal. What am I going to do now? Like I say, if you've got hiking poles, the next step's easy. I don't have any. But what I do have is I have wood where I am. So I haven't prepared this, I haven't looked for them. Let's see if I can find myself 2 improvised hiking poles. The sturdiest pole, put on the affected side. Don't spend too much time doing this. Okay, I'm starting to get cold. It's time to get back to safety. First, I'm going to have some more water. I'm a little bit shocked by all this. Now if you're on your own, you can't weight bear even with help of these, the next thing you have to do is you have to splint the foot and see if you can get to safety. If you can't get to safety, you're going to have to stay where you are. Get the stuff out, get camping. Not a preferred option. You're injured, take it seriously. You're going to leave most of your heavy weight behind you, so having a smaller secondary pack if you're going hiking or bugging out is always a great idea. In this case I'm just going to take these because I know the house is about a mile away and I know the route. If I don't know where safety is, I might have to take everything. If I can't carry it, I have to camp where I am until I can. I might have to go 500 meters, camp, 500 meters and camp. Do whatever it takes. You're injured in the wilderness. It's going to kill you if you don't get back to human society. I'm assuming you have a first aid kit. You hurt yourself. It hurts. What are you going to take as an analgesic if you brought one? By now you know you should never take aspirin unless you're taking it for stroke or heart attack prevention. Specifically, I have got a busted ankle and it's bleeding because I can see bruising. The more bleeding, the tighter it gets, the more at risk I get. More on that later. No aspirin. I have ibuprofen, Advil. I also have Tylenol, paracetamol, acetaminophen if you're an American. If you've suffered a traumatic injury, which of these do you never take in the first 24 hours? Tylenol, first 24 hours. It's not as effective as the Advil, but it won't cause bleeding. You want to minimize bleeding. After 24 hours, start taking Advil. It's great for reducing inflammation. And after 24 hours, if you're still not actively bleeding, this is great for that. Truth is, I'm probably going to take both of them after 24 hours. But definitely for the first 24 hours, Tylenol only. Holds true for any traumatic injury where you might be experiencing bleeding. Holds true for a radioactive environment. You don't want to bleed. Now when I put my shoe or my boot back on, I'm going to make it as tight as possible. Wellington boots aren't ideal for this. That's why I actually wore them today. You might want to consider using a compression bandage. We're going to do that indoors. I'm going to rest as much as possible on my way back to safety. When I get back to safety, I'm going to rest as much as I can. I'm going to elevate the affected limb as high as I can tolerate. I'm going to use ice if it's available, or in this case, probably use snow. You don't put ice or snow on direct contact with your skin, and you only do it for 20 minutes every hour or so. If you have no ice and no snow available, use cold water. That works just fine. But again, only 20 minutes per hour. Don't do it more than that. If you have those fancy cold packs, you can use them. But again, don't put them on direct contact with the skin. And only 20 minutes for every hour. I'm going to check the colour, sensation and movement, CSM, about every hour for a little while. Very worried that it might develop into a more serious problem. But I think I'll do that inside as well. So in my case, I had a stable injury. What happens if I had an unstable injury? What happens if I couldn't weight bear and I couldn't stand up and I couldn't walk? If you're on your own, you'll do this. You're going to do this. Check the colour again, check the sensation again. Can you feel all around dull? Can you feel sharp all around? Can you move everything even slightly? When you squeeze the nail bed and you let go after 5 seconds, does the colour come back within 2 seconds? Now if you're elderly and you're decrepit, it might take longer. Know you're normal. In this case, colour, sensation and movement here is absolutely... I can't move this toe. It's whiter than anything else on the thing. I can't really feel sharp. I sort of feel dull. Oh my goodness. I've lost blood flow to this toe. If I don't resume it within an hour, I'm going to lose this toe. I'm going to get gangrene, might die if there's no healthcare available. Get permission. Huples, your toe's messed up. I'm going to have to try and fix it. It's going to hurt. Is that okay? Yes. Gently pull away from the body. If colour, sensation and movement rapidly comes back, splint it in the extended position and try different parts of the damaged foot pulling it and then splint it in that position. Stop if the person tells you to stop. Resume with their permission. Stop if you're encountering strong resistance. Stop when colour, sensation and movement returns to normal. Splint it in the extended position. You're going to splint the joint that's affected, the joint below the affected joint, and the joint above the affected joint. We're going to do that indoors. It's getting really cold. No weight bearing. You have to make some crutches for them. They can walk, but they can't put any weight on the affected limb. If when you take the sock off you see a lot of blood and bones sticking out, that's called an open fracture. You've diagnosed it, well done. It's the same procedure in the wild. Pull with permission, splint in place. It's absolutely even more important to do that. But before you do that, flush the whole area as far as you can with clean, tepid water. You're probably going to have to use cold water. You're not going to use very hot water for this. Don't put anything in it. Don't use super glue. Just flush it with water and pull. It's called putting traction on it. And once it's got colour and sensation back, you then splint it.
You'll need to try to restore CSM before building a splint. The best way to do this is to slowly and gently pull traction on the extremity as you try to move it back into an anatomically correct position.
I'm going to put my shoe back on, it's freezing. Now if it's a disaster and you're bugging out, and you probably shouldn't bug out, but you might have to, you're going to have to treat the open fracture. You're going to have to treat the closed fracture. You're going to have to treat the bad tear or rip of the ligament or tendon. And you're going to basically do this by good nursing care and splinting. And like I say, we'll do that inside. Now you want your first aid kit in the top or in a side pocket. You don't want to be rooting through the entire pack getting this. And this is my hiking first aid kit. You'll notice I've got a splint on it. I would probably use the splint. I would definitely use an ace tensor bandage. But I am going to do that indoors. You'll have to do it in the outdoors if you're injured. If you don't have this and you don't have this, you're going to have to improvise. You might have to take off a t-shirt and cut it into strips to make the splint attach to the leg.
If the injury is to a joint, to fully immobilize it, you'll need to build the splint to include the bones on either side of the injured joint. For example, if your knee was unstable, you'd need to build the splint to extend from high up on the thigh to just above the ankle. If the injury is to a long bone, you'll need to build the splint to include the joint on either side of the break. If it was your forearm that was broken, you'd want both your elbow and your wrist immobilized in the splint. With most musculoskeletal injuries, you probably won't need to pull traction. As long as there is no impairment of distal CSM, and as long as there are no bones sticking out, you can probably just splint it in whatever position is comfortable for the person.
If you have no snow or ice available, find yourself a stream and completely submerge the affected area in that for 20 minutes every hour. The ponds aren't quite firm enough to go walking on yet, but it won't be too much longer. I think this snow on the ground here is going to stay now till February or March or even April. So soon I'll be out here in snowshoes. And snowshoes really can do your ankle in. Thanks for watching. I'm Huples Cat. Give me a sub. Get out there. Do it safely. Enjoy yourselves. Doodles. This has been a Tiny Terrier 2023 production. No terrier got cold during the making of this video.